Tesla Akers, and for the Health 530 final project, I have chosen to implement a program that is called the Fundamentals of Obesity. The program overview that I have on my first slide here is to just give you a brief overview of what the program is. This program is an after-school program for grades K through 8, and this will be implemented into the Mercer County Public Schools. This will consist of knowledgeable classes on obesity and physical activities. These knowledgeable classes will be in a classroom setting. They will provide statistical analysis and lectures from health professional figures in a classroom setting twice a week for the participants in this program. And then the physical activity portion will be of a basketball portion of activities for extracurricular activity in a gym. Kids of this age love the game of basketball for an extracurricular activity. They play it in recess and physical education classes. This is a highly popular sport from grades K through 8, and I thought it would be a great way to implement this into this program to draw participants. This is a 3-month program. It will stretch from March 1st to June 1st. With this being said, it gives a great time of analysis and for data to be collected if a participant is changing their weight, changing their health habits, and even changing their knowledge as far as what obesity is and do they have loved ones or themselves suffering from obesity. Even at a young age, they can decide this. 3 days of physical activities. Like I said, this will be with basketball, the sport of basketball. This will be on Monday, Wednesday, Friday, after school for an hour each day. You have 3 opportunities to go to one of these physical activities. All students have trouble doing extracurricular activities. Sometimes it's their parents' work schedule. Sometimes it's a commitment thing. But if it is something that they enjoy, like basketball, I think that we will get more participants for the program. 2 days of knowledgeable classes on obesity. This will consist on Tuesdays and Thursdays. This will be the classroom setting once again for 1 hour. This gives the participants opportunities to learn more about the disease of obesity. The program goals. Our first goal is to promote knowledge and ways of preventing childhood obesity. The objective here is that with educational classes twice a week, being in the classroom setting, learning about obesity, a disease that they may not have had any knowledge about prior to this program, this gives them something that is not physically active, but still learning how to live a healthy lifestyle, even at a young age. Our goal here in a second, our number 2 goal, is to increase physical activity by decreasing the amount of children inactive. The objective here is to increase the number of participants. We require our participants that are going to participate in the program to only be there for once a week for the physical activity portion and once a week for the knowledgeable classroom settings as well. But we hope by the end of this, our goal is to have more participants wanting to come more than just once a week. We want them there every day if they can be there. Then our goal number 3 is to reach the community of Mercer County to a level of implementation to all age groups of this program in the future. Our objective here is to reach other grade levels, to reach other schools in the county, such as private schools, upper level classes. With this, we believe that our goal should be to touch every school and every kid of all ages in our county to make our county more of a healthy atmosphere for our students. The targeted population here in the rural area of Mercer County, West Virginia. We are located the most southern part of West Virginia that you can get. Mercer County is measured at about 421 square miles. The population for Mercer County, according to the United States Census Bureau in 2015, was about 61,000 people. Mercer County ranks as the 51st county, with 55 being the absolute lowest in the state of West Virginia for health outcomes. This is according to the Health Rankings and Roadmaps in 2016. These roadmaps and rankings are based on obesity, based on inactivity of physical adults. This ranges from a lot of different things, but to be one of the lowest in the whole state is saying something that this area really needs to touch a younger generation and get them in their minds early of the healthy and active lifestyle. The program size. Hopefully we are expecting about 30 to 50 participants each day in our program. Like I was stated earlier, we only ask our participants to participate in one physical activity day with basketball per week and one knowledgeable obesity classroom setting per week. Now, we encourage them to come every single day, but only requiring one of each. Expecting 30 to 50 students per day at each school, and in contact with healthcare professionals, educators, and mentors throughout the entire program. They will have numbers on these staff members that we have in this program. They will be able to contact them with any questions, any concerns, or any ideas to put into the program. The location of this will be in local elementary and secondary public schools in Mercer County, West Virginia, using a classroom and a gymnasium for the setting of the participants for all of the grades and all of the exercises that we will implement. Now, if the school has access to an outdoor facility as far as basketball goals, things that way, or maybe that day instead of sitting in desk in a classroom, we will have the classroom outside in the grass of the schoolyard. That is awesome. We're going to do a very variety of things with this program, but this is really the basic setting that we have. I want to break down the two areas that we're going to have in this program, one in the classroom setting and one in the basketball setting. The classroom I'm going to do a little bit more of a descriptive conversation about, because I will downstairs after this PowerPoint presentation demonstrate the basketball fundamentals that we will be discussing with each participant and showing them how to be physically active and with a basketball in their hands. But this is the knowledgeable classes on obesity. This will consist of lectures and lessons that will be brought to us by volunteers or paid staff members of health professionals, such as doctors, nurses, scientists, physical therapists, nutritionists, a lot of different health professional figures, even the health teachers and educators and physical education teachers in our school systems. All of these people will play a huge role because we all look up to someone. These are major jobs in the health field that these young children, K through 8, really look up to and want to hear more about their job and how obesity and how physical activity relates to their job. The second area is statistical data analysis and percentages. Each one of those health professionals, I'm sure, will create their own great lesson, it being hands-on and it being very statistical and showing the data where they get their results from and why they believe what they do. But it is important to make the kids K through 8 to see a visual. Everybody's very visual at a young age. It is very important for them to see a visual example up in front of them of all of the statistics and how low Mercer County ranks, 51 out of 55. Prevention strategies of implementation. This is where I think it's very important for the kids to learn how to prevent themselves from becoming obese, how to prevent their loved ones from becoming obese, what changes they should make, and the strategies of their lifestyle, whether that's diet and nutrition, whether that's physical activity and exercise. It ranges from many different aspects of their lifestyle, but this is where I hope that our health professionals and trained staff picked for this program discusses with them the importance of implementing new things into their daily life routine. This is the fundamentals of basketball section. Like I discussed downstairs after this presentation, I will demonstrate each one of these to give you a hands-on look at what the program is going to do on the physical activity days. Dribbling is the first fundamental. Dribbling, passing, and shooting. You can't do any of those and not play basketball. So dribbling, you can't go anywhere without dribbling. So basic dribbling drills, stationary, and also moving. Okay, we will do a lot of different variety of drills in all of those. But they can do one by themselves and two with partners and other peers. Passing is the second fundamental. This will be basic passing drills with a partner and with self, of course, stationary and moving. You got to make this very accessible to the kids to be able to do it at home on their own if they don't have siblings or a parent to do it with them. For them to be able to do it at school on the recess yard. The last one is shooting. Basic shooting drills showing a stance and form, both stationary and moving. All three of these fundamentals are very important, and it's also in an area where the kids absolutely love this extracurricular activity. I think this will draw a lot of population to them. Then I want to give you a program layout. This is kind of the schedule that we've decided to do. This is the January through February 2017. Will be the organization and advertising and promoting the program process. During these 2 months leading up to the program, it is important to get the program out there in the school system, in the community, at doctor's offices. Talk to as many people as you can, get as much volunteer work, and as many flyers and brochures as you can. March 2017, this is when your program begins. This is when that advertising can still be going on because your program is just starting and you want to increase your numbers and have your participants tell their friends and keep joining the process at an early stage. The survey of the knowledge of obesity and the knowledge of being physically active. This will occur during that first week in March of how much the students know about obesity, how much they know about being physically active. Their weigh-ins will also occur here. We will weigh each participant and see what their body weight is at the very beginning of the program, just to see how many changes that we get to the end of the program. Then we will have the introduction to the program begins, physical activity begins, the knowledgeable classroom settings begin, and this will be held, like I said, twice a week for the classrooms and 3 times a week for the physical activity. Then in April 2017, the program will continue. It will continue the 2 times a week on Tuesdays and Thursdays for knowledgeable obesity classroom settings, and then it will have 3 Monday, Wednesday, Friday physical activity days for the participants. Then in May 2017, it's our last month of our program, we're really going to push the kids hard on the knowledge, make sure they get all the knowledge they can about obesity and making changes to their lifestyle. But also we're going to make the physical activity, we're going to bump up the drills, bump up the skills, make sure that they're going at high capacity and getting all the physical activity that they can. Also in this last month, we will be doing another survey. Same survey as before with a couple more questions. It basically will be talked of how you have improved. What is your knowledge improved? How much more do you know now than you did in March when we started the program? Then we will finally do our last weigh-in, the weigh-in for the program. See if our participants lost any weight at all. Then there's the program budget. Every program has its funds. Hopefully, I have given you 2 different options. We hope to get as many donations as possible to where this could be a almost fully program that is donated around the community. With donations, this first chart up above says the maximum cost within 3 months, 250 people per school. The advertisement, this is your brochures, your flyers, getting out in the community. At $200, you must have access to a copier or a print shop for these things. The classroom supplies. This is the pencils and paper that you will need in the classroom setting. The whiteboards and markers and the PowerPoint presentations, the computer for things like that. We put that at $300. Hopefully the people working the program and the staff can donate a lot of this of their own personal gear and things in the classroom setting. Then the staff member's salary. Like I said, most of ours should be volunteer staffs if possible. If they do not, we hope to only spend about $1,000 of getting people and health professionals there to work this program. The miscellaneous, we always need to make sure that we have a backup in case something would go wrong or a goal in the gym would break or anything of that sort with the program. So we always need to have some extra funding there. So we've set aside $500 for that, which brings you to a grand total of $2,000 with a lot of donations for the program. Now, if you do not have any donations, don't panic, but the cost is going to go up for the program, and that is something as a program coordinator that you have to be ready for and organized for to make those changes. Without any donations, you are looking at about $250 in advertisement, not much up from before, but still increasing a tad. Then you're looking at rental property. See above, we did not have rental property. The school provided the gymnasium and the classroom setting. But if not, and we have to rent that from the school or rent that in from the community, you're looking at about $1,000 of rental there for the 3 months time of the program. Then you have the staff member's salary. This will go up, of course, that we have more people asking for money that cannot take away from their jobs in the community to do this program for us for free. So we have $2,250 there, increasing by $1,250 there from above with donations. Then you have the miscellaneous. Once again, you have to have a backup plan and extra funding in case something would go wrong. It's still at $500, which brings you to a total of $5,500. This is a great jump between the two. Now, hopefully, like I've talked, you can get out in the community. You can get out in the community, research your program, and put your program out there and tell them why it is important that we need their help and donations of things. The resources that you're going to need. The resources for this program are very basic, but also can be donated. Posters, brochures, flyers. This is very important to get out in the community and show your program off. Get people there. Get parents to want to put their kids as participants. Then you have your projector screen, your whiteboard. A lot like I'm using now, but me presenting is an example of what our health professionals will need to present to our participants about their health concerns. Writing utensils and paper. This is important for the kids who will be doing hands-on things in their classroom activities. Also a weight scale. The weight scale is used for the beginning and the ending weigh-in for our participants. The 10 health professional staff members. This is per school. 10 health staff, you need 10 staff at least, because everyone cannot be there all day long. With 30 to 50 kids per day, you need a lot of adults there advising and making sure that they're understanding the material and getting physically active in the right ways. Gymnasium with access to basketballs and hoops. This is important. 3 days a week of this program is all physically active with basketballs and hoops. You need these. This is our second to last resource. Our last resource is classroom with sitting area and accessible technology resources. Need somewhere comfortable for the participants to relax and listen. Take all the information in that they can from the health professionals that are there to give it to them. Then this is my last slide of my presentation. The outcomes. The outcomes for this program is what we hope to get from this program after implementing it into grades K through 8 in Mercer County. Physically active for at least 60 minutes a week, possibly 180 minutes per week. We hope this for each child. Like said earlier, we hope that each kid at least participates in 1 day of the physical activity program.